Imagine misplacing your keys or forgetting why you walked into a room. It happens to all of us, right? But when does this become more than just a harmless lapse in memory? Knowing the difference between normal aging and dementia is not just helpful, it's vital for early intervention and support. In this video, we're diving deep into what's normal and what might be a sign of something more serious. Stick around to learn how you can spot the signs and take action. Why understanding dementia versus normal aging matters. Distinguishing between normal aging and dementia isn't just a matter of curiosity, it can change lives. Early recognition of dementia symptoms allows for timely medical intervention, better care planning, and improved quality of life. Plus, it helps families understand and support their loved ones better. The earlier the signs are spotted, the sooner steps can be taken to manage the condition effectively and provide the necessary care and resources. Dementia affects millions of people worldwide, and the numbers are growing. According to recent statistics, Alzheimer's disease alone affects over 6 million Americans, and the prevalence is expected to rise in the coming decades. These numbers highlight the importance of awareness and education on this topic. Common misconceptions about memory loss. Many people believe that memory loss is an inevitable part of aging. While it's true that some cognitive changes occur naturally as we get older, dementia is a serious brain disorder that goes far beyond ordinary forgetfulness. Let's explore some of the most common myths. 1. Myth 1. Everyone who forgets things will develop dementia. Truth. Memory lapses are common and can happen due to stress, fatigue, or distractions. Dementia involves more severe and persistent symptoms. 2. Myth 2. Dementia is solely a result of aging. Truth. While aging is a risk factor, dementia can be influenced by other factors like genetics, lifestyle, and underlying health conditions. 3. Myth 3. There's nothing you can do to prevent dementia. Truth. Research shows that lifestyle changes like staying active, eating a healthy diet, and engaging in mental exercises can reduce the risk. What is normal aging? Aging naturally brings changes to the brain, but these changes are typically mild and manageable. Here are some examples of normal, age-related memory lapses. 1. Occasionally forgetting names or appointments but remembering them later. 2. Misplacing items like glasses or the remote but finding them after retracing your steps. 3. Struggling to recall a word but being able to communicate effectively overall. 4. Taking a bit longer to learn new skills or adjust to technology. These changes are usually infrequent and don't interfere with daily life. They're part of the brain's natural aging process and don't signal a larger problem. What is dementia? Dementia is not a normal part of aging. It's a group of brain disorders that affect memory, thinking, and behavior. Alzheimer's disease is the most common type, but others include vascular dementia, Lewy body dementia, and frontotemporal dementia. Unlike normal aging, dementia disrupts daily life and independence. Let's break it down. 1. Alzheimer's disease. The most common type, marked by progressive memory loss and confusion. 2. Vascular dementia. Caused by reduced blood flow to the brain, often after a stroke. 3. Lewy body dementia. Includes symptoms like visual hallucinations and movement difficulties. 4. Frontotemporal dementia. Affects personality, behavior, and language more than memory. Dementia affects each person differently, but common symptoms include significant memory loss, confusion, disorientation, and changes in mood or behavior. It's crucial to recognize these signs early to provide the right support and treatment. Key differences between normal aging and dementia. 1. Memory loss. Forgetting where you parked your car is normal. 1. Forgetting you own a car might not be. 1. Normal memory lapses are infrequent and don't disrupt daily life, while dementia-related memory loss is persistent and interferes with independence. 2. Problem solving. Occasional mistakes with bills are common. 2. Struggling to follow familiar steps, like cooking a favorite recipe or managing finances, could signal dementia. 3. Communication. Everyone loses their train of thought sometimes. 3. Persistent difficulty finding words, following conversations, or repeating the same questions is a red flag. 4. Behavioral changes. A slight mood swing is normal. 4. Drastic personality changes, increased frustration, or aggression might indicate dementia. 5. Judgment. Making an occasional poor decision, like overspending on an item, is normal. 5. Poor judgment that repeatedly puts someone at risk, like forgetting to pay bills or neglecting hygiene, is concerning. Impact on daily life. The real distinction lies in how these changes affect everyday life. For someone aging normally, memory lapses are minor annoyances. For someone with dementia, forgetfulness can disrupt basic activities like dressing, eating, or managing medications. Dementia often results in 1. Difficulty completing tasks that were once familiar, like driving or preparing meals. 2. Needing constant reminders or assistance for daily routines. 3. Becoming withdrawn or isolated due to confusion or embarrassment. Risk factors and causes. While aging increases the risk of dementia, it's not the only factor. Genetics, cardiovascular health, lifestyle choices, and head injuries all play a role. Here are some key contributors. 1. Genetics. Family history of dementia can increase risk, though lifestyle changes can still make a difference. 2. Health conditions. Hypertension, diabetes, and obesity are linked to higher dementia risk. 3. Lifestyle factors. Smoking, excessive alcohol use, and lack of physical activity can contribute to cognitive decline. Staying physically active, eating a nutritious diet, and keeping your mind engaged can help lower your risk. Regular checkups with your doctor can also catch early signs of conditions that may lead to dementia. Early warning signs to watch for. 1. Forgetting recently learned information. 2. Misplacing items in unusual places, like a wallet in the fridge. 3. Difficulty following directions or conversations. 4. Struggling to perform familiar tasks, such as balancing a checkbook. 5. Experiencing confusion with time or place, like forgetting the day of the week or getting lost in a familiar location. If you notice these signs in yourself or a loved one, don't ignore them. Early diagnosis makes a significant difference. Seeking a professional diagnosis. Self-diagnosing is never a good idea. A healthcare professional will use cognitive assessments, brain imaging, and medical history to provide an accurate diagnosis. This clarity is essential for managing the condition effectively. During the medical evaluation, you can expect 1. Cognitive tests. Assessing memory, problem-solving, and language skills. 2. Brain imaging. Scans like MRIs or CTs can identify abnormalities. 3. Blood tests. Rule out other conditions that might cause similar symptoms, like vitamin deficiencies or thyroid issues. Managing and coping with dementia. Families play a critical role in supporting loved ones with dementia. Creating routines, simplifying tasks, and encouraging social interaction can make a big difference. Some practical tips include 1. Breaking tasks into smaller, manageable steps. 2. Using reminders like calendars or alarms to stay on track. 3. Providing a calm and supportive environment to reduce anxiety. Medical treatments and lifestyle changes can also help slow the progression of symptoms. While there's no cure for dementia, medications can manage symptoms, and therapies like cognitive stimulation can improve quality of life. Tips for healthy aging. 1. Brain health. Challenge your mind with puzzles, reading, or learning new skills. 1. Activities like crosswords, Sudoku, or taking up a new hobby keep your brain sharp. 2. Physical activity. Regular exercise improves blood flow to the brain. 2. Aim for at least 30 minutes of moderate activity most days of the week. 3. Social connections. Stay engaged with friends, family, and your community. 3. Loneliness and isolation can accelerate cognitive decline. 4. Nutrition. Eat a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. 4. The Mediterranean diet, in particular, is associated with better brain health. Understanding the differences between normal aging and dementia is essential for early detection and care. By recognizing the signs, supporting loved ones, and adopting healthy habits, we can face aging with confidence and compassion. Together, we can ensure that everyone, young and old, receives the care and understanding they deserve.